Doug Brown, in his memoir, recalled Alfred Sloan's comment that hospitals should be run more like a business. And if you've read anything about or by Alfred Sloan, you know that the quote for which he is famous is, "The business of business is business." And 2 years in the business school seemed to me, in fact, to be much more about business than people in business. And in one of the few classic hospital administrative texts at the time, called Modern Concepts of Hospital Administration, a book which was dedicated to Malcolm McEachran, and which Dr. Milton Romer, then a founding member of the Sloan faculty, was a contributor, Joseph Owens, the author, in '62 observed, "In the acute phase of illness, there is little awareness on the part of the patient of even of the existence of the hospital administrator." I was soon to know why. We graduated in '66, and I arrived at my first hospital job at the University of California Medical Center in San Francisco in the midst of the escalating anti-Vietnam War protests, the formation and actions of the Black Panthers, the flower children who had come to Haight-Ashbury just blocks away from the hospital, the emergence of Joni Baez and her Songs of the Times, and the Rolling Stones' first appearance in the U.S. following Satisfaction. And on my first day on my job in July 1st, the implementation of Medicare and Medicaid, the first organization chart on which I appeared had 6 boxes under that of the administrators. 2 associate administrators, 2 assistant administrators, of which I was one, a finance officer, and the director of nursing, whose office was, of course, not in the administrative suite. Now, this was, of course, prior to health planning, certificate of need, health systems agencies, and the whole notion of marketing and PR in hospitals, all of which would have their own box on my later organization charts. We would subsequently look back at these years as the golden years. I soon learned what hospital administration was about at the time, and it was not about patients, not about patient contact or patient issues at all. My new suite mates arrived in the morning in their suits, came to their respective offices, regathered at noon to go to the cafeteria. They sat at their own table, and I always wondered why. I mean, must have been an unwritten rule that nobody else could sit there. Then they returned to their offices, worked till 5, and left. All of their direct reports came to their offices to meet. And in retrospect, I think this might be one of the reasons why the term suits became later a derisive reference for healthcare executives. Well, I lasted about 4 months with that, and I started walking around patient floors, introducing myself, conversing with nurses or anybody who was free or would listen, and found that as a member of administration, I was a person of interest. Often I was introduced to patients, and I began to learn, and I began to really enjoy my job. Soon I was unable to enjoy my colleagues for lunch, as I had become a member of a host of patient floor, nursing committees, and others. I remember the Pediatric Advisory Committee, called Pediatric Unit Advisory Committee, PUAC, was exploring the brand new concept of a pediatric intensive care unit. These committees met mostly at noon, mostly brown bag style, and I learned over those early years more than my administrative colleagues would ever know about the real issues and interests among the staff caring for our patients. That experience would lead me later on as a CEO to a model that I defined as staff and patient values driven, high visibility, open access, observed knowledge of the issues at the point of care, and an obsessive focus on people, both staff and patients, a philosophy portrayed today very eloquently by Peter Banco. So perhaps with a different focus than our founding beneficiaries, I agree that hospitals should be run in a business-like manner. But I also know that healthcare is not a regular business, nor do pure competitive models apply to it. Hospitals are unique social institutions, more people-intensive than any other, uniquely staffed with people who came there for a special purpose, with a mission even, or who grew up knowing, how often have you heard this? That they wanted to help others. Doug Brown concluded in his memoir that little has changed in the delivery of healthcare other than technology in the last 50 years. I would submit to you that for many of us here, there is today the recognition that administrative leadership in healthcare has enormous potential to impact the clinical outcomes of our patients by building powerful cultures that nurture, develop, listen to, and recognize the commitment, dedication, and achievement of the thousands of people who really care about this business of ours. What greater reward could we have? In the end, that is why I, for one, supported our program's move to human ecology, and I've been grateful for the welcome and increasing support and recognition Sloan has received. And we appreciate Dean Alan Matthews' confirmation today of the value of the Sloan program. In conclusion, I, as are so many of us, am grateful for our professional opportunities and rewarding careers thanks to our experience here at Sloan. We've shown our appreciation in many ways. We served as preceptors, mentors, lecturers, presenting on colloquia, hire our grads, contribute financially to our program. It all goes back to Alfred and Raymond Sloan and the persistence of President Millott, and we recognize their foresight on occasions like this. And from those early years through tonight, many have contributed to the growth and excellence of this program, and so many of us are beneficiaries of their efforts. Now, most have come and gone, but for us to be here tonight as products of one of the country's prestigious and most successful programs, celebrating its 50th year of achievement, I conclude that this would not have been possible but for the tenacity, the perseverance, the loyalty, and the dedication to the founding mission of the Sloan Institute over all these years by Doug Brown and Robert Battistella.